The next part of our international conference is a panel discussion. I invite the moderator, Professor Sobana R., the administrative in charge of School of Music Therapy. The title of the panel discussion is Biopsychosocio Spiritual Models in Music Therapy.
Can I invite the panelist onto the stage? Dr. Baishali, Professor Sivaprakash, Dr. Ananda Balayogi, sir. Yeah. Good afternoon, all. So it has been a very wonderful experience since morning, and all of us are in a state of trance so that we are lost in the musical vibrations, sounds, and so on. So it's not going to be very formal as it used to be. I feel let's all talk from our soul. No? Let's all be ourselves and talk from our soul. So we plan to have a 40 minutes of panel on the different aspects or perspectives of music therapy. So when we start, myself, Professor Shobana, would introduce myself as a physiologist, basically, and I entered into the field of music therapy as a researcher, helping out my head of the department, Professor Bharati, who was the head of the music medicine unit, which was around 12 years. So me first felt music therapy as it was told by the speakers in the morning as something which would modulate the endocrinal system, the autonomic system, and so on. And when I started to be here along with the fellow music therapist, I understood it is much more than that. After few years, I realized the psychological aspect of music. And many of my personal experiences, one which I would like to share is my mom, who was in her terminal days. I felt I should give something good to her, and that's when I brought her to the yoga therapy unit. So she used to hear, she used to chant, and she used to hear music every day and throughout the day. So I understood that music has the spiritual aspect as well. Now, when I looked into the literature, or I could say that the word holistic healing was introduced to us by Professor Madan Mohan around 12 years ago, who is the Bhishma of the yoga therapy. And salutogenesis is brought to us by Professor Seturaman. And I was talking to Dr. Annie, who said instead of looking at pathogenesis or looking at a patient as a disease, look at wellness of a patient. So when I looked at literature with a single line, I will finish. The word health or holistic healing came into existence from 1955 by the WHO, where it says that health is not absence of disease. It is social, physical well-being. Whereas in 1999, the concept of spirituality was added. Now, today let's talk about how each one of us feel music therapy could fit into this model, the biopsychosocio-spiritual model. So I would like to introduce the panel here. So I have Dr. Prahankumar. I would tell one line which all of us know and one line which people don't know to keep the audience interesting. One is he is the head of the Department of Community Medicine, and the yet another is he is an expert of certain fields which we don't think at all. He is an expert or the person who first introduced artificial intelligence in the medical college. He is a person who has been practicing mindfulness, and to say his department has got the award of the best department in MGMCRI. So welcome, sir. And I have Dr. Baishali here, who has been associated with the School of Music Therapy for more than 10 years. So which you all don't know is me, when I was a student of postgraduate diploma music therapy, she was my examiner who pointed out lots of mistake in my thesis, and she politely told me, madam, please correct all this. So, and she still continues to help out our students. Each and every thesis from the School of Music Therapy Dr. Baishali guides. She is basically a psychologist and a music therapist by profession. And welcoming you here, Dr. Baishali. Yes, we have Professor Sivaprakash sir here, the head of the Department of Psychiatry. Sir was the father of the music medicine unit even before the day zero. Professor Sivaprakash, along with our registrar, was responsible for the inception, and sir has authored the MGMCRI anthem. So I think many know that another thing to tell is sir is a man of perfection. So he looks into minute details, and I told sir I should learn this from you. So he's a proud father of the daughter who got into JIPMER very recently. That's a personal note. And welcome, sir. Yes. We have our director, Professor Ananda Balayogi Bhavanani. Yes. So this clap before I start introducing speaks 1,000 words. No, how much a leader has to be. I learn every day from sir how to respect each and every person. It might be from the VC, or it would be a a physical worker or an attender in the department, is given due respect and treated with dignity. And our friends call, Uma madam calls Yoga Ji. So sir is an embodiment, and he has taken ISCM to the global level. So we are very happy to have the panel here. So with this introduction, can I ask Dr. Prahankumar, how do you feel music therapy would fit into this biopsychosocial spiritual model of healthcare? Your views or your experiences would be nice for the audience to hear.
Good afternoon to all. At the outset, I thank you, ma'am, for providing this opportunity to be part of this esteemed panel discussion. To begin with, when we talk about, ma'am gave the overview of this biopsychosocial spiritual model. And as correctly said, this holistic model of health has been recently in discussion. Although we know that when we talk about health, by default, more attention is given to the physical or the biological domain. When talking in context to the music, we can see that the same picture is more reflected in music therapy as well, because when we talk about music therapy, we focus more upon the impact of music on an individual level. Um, I would like to highlight more about the social component because that is my subject expertise. So what I felt, even in health, that challenge we are facing when we address health issues at community level, or even at a holistic level, at a even governmental level, the more focus is given on the biological aspect, and we tend to neglect or not give much attention to the social component of health or the social dimension of health, and that is facing a lot of challenges because of a lot of, I would say, like evolution in the human society. For example, even the social structure is disintegrating every day because of various components like the evolution of social media, where the one-to-one human connection is getting lost. So the social aspect of health is itself compromised in today's lifestyle. And music therapy has the beauty that it has an intrinsic component where it unites people, because music has a language which is universal, which transcends all the borders or all the barriers created by human being. The borders of, you can say, like because of caste or language or religion or age or gender, all these barriers are crossed or overarched by the music. So when music therapy is instilled as a therapeutic module, it brings about not only change at the individual level, but also at a community level. And community music therapy is one of the very well-known social model of music therapy, which has been in discussion past few decades, and that has been proven, has provided a lot of benefits to people in large gatherings. And it provides not only as a therapeutic model, but also an opportunity for individuals to communicate, especially those who have that, I would say, like biological difficulty in communicating in our human language. Because through music, individuals with special needs, they are able to express. So music therapy has another advantage of bringing the social change, where it provides a platform for individuals with special needs to express themselves, to connect with others in a larger level. And another aspect is music therapy is providing an opportunity where we can bring about a I would say like create harmony in the society. So that also contributes, I would say, highlight the social aspect of music therapy. So although all the models are important and everything has to come go together, but the social model is one aspect which we need, I personally feel, has to be given more cautious attention, because we tend to neglect that naturally because we don't think about it consciously. So we have to think in a manner where we can bring about people together for music, not only as a therapeutic model, but also a model where we can come together and create a platform where we share things together. Another last aspect I would touch is music brings about change, which is, as in the previous session we saw, even changes at the level of the vibratory level, the koshas. And those are the realm which is common to all human beings. So that social aspect is there where we touch music and everyone come together, where we are able to understand what's happening and we feel connected with each other.
Sir, very clearly pointed out. I could feel that the group choir which happens or group chanting, the feel, all these settle down to this. So, Dr. Baishali, what is your views about the psychological perspectives of music therapy as far as your experience?
Yeah, thank you, Dr. Sobana. And first, I would like to say that I'm honored to be here on this platform with Dr. Ananda sir, Sivaprakash sir, and Sobana ma'am, Dr. Prahan. And thank you very much for this platform. So, from my psychological perspective, first of all, that what I understand about biopsychosocial spiritual model, it is looking at healthcare through multi-systems lens. So, and also understanding the comes from how my patient is behaving in clinical context. So, behavior itself talks a lot about psychological perspective. So, it is looking at the clinical symptom and most importantly, what is behind the symptom, that why the person is behaving in a certain manner. So, any maladaptive behavior, any maladaptive thought, maladaptive emotion, as it is a symptom for mental health to me as a psychologist. So, in the same manner, that symptom is maybe the cause of a disease in a human being. So, which actually goes for the biological side. And again, at the same time, that what Dr. Prahan was mentioning, that we are social being, right? So it's always come to the context that how I'm interacting with others, and my health is coming into that context, that how is my behavior, how I'm emotionally well. So altogether, this well-being aspect we can basically talk in different categories of healthcare components. If I say that there are 4 primary factors in the healthcare through music therapy that we definitely consider in the treatment process are predisposing factors, precipitating factors, perpetuating factors, and protecting factors. So I think music therapy is something we can address to all of these factors. For example, predisposing is going towards biological factors. I mean, precipitating and perpetuating, definitely psychological and social factors. And protective factors, of course, it is our spiritual aspect of our life, our practices, our belief system, what are basically protecting us all the time. So music therapy, you can say it is an umbrella where all of these perspectives and theories, they fit very well into it.
That's really a wonderful thought. So, can I ask you, Professor Sivaprakash sir, about your thoughts as a practicing psychiatrist and a passionate musician?
Thank you, madam. Thank you for this opportunity once again to be a part of this panel discussion. Just a line about myself. I'm, apart from being a doctor, I'm also a self-taught amateur musician. Not proficient, but very passionate. And I play the keyboard and I use software to compose music using a computer. So now coming to this biopsychosocial spiritual model, we use it all the time in medicine. we teach our students, we show them the picture with the three intersecting circles. George Angel was the person who spoke about it first, the biological, psychological, and the social aspects. But now when it is very important for us to apply that model to music also. Now, when I read about it and when I think about it, what I understand is that, first of all, I think that spiritual is part of psychological. The brain is the substrate for all human experience. In fact, there's a lot of research now that shows that all the spiritual experiences we have, they're all generated in the brain, nowhere else. So ultimately, rather than intersecting circles, I would look at it as the brain being the final common pathway. So all your experiences, whether they are psychological or spiritual, and the various emotions you experience, they are all processed in the brain. So it's like a final common pathway. And there has been a lot of research on the reward system, also the mesolimbic reward system. So there's a lot of research now that shows that for music to be effective, for music to be used as therapy, whether it's listening or working with a music therapist, for it to be effective, it should activate the reward system. In other words, the client or the person or the patient should experience it as pleasurable. And that doesn't mean happy music or sad music, because there's a lot of research that shows that people can perceive sad music also as pleasurable. So is it pleasurable? Does it trigger my reward pathway? And dopamine, by the way, is a very important neurotransmitter in that pathway. So if it does, I'm hooked to it. And that is, by the way, the basis of things which are important for evolution and preservation of the human race: food, sex, and so many other things. So there's a lot of research that shows that music actually triggers the same pathways which are essential for human evolution and, survival. So, that is the crux of the matter. Does the experience trigger the reward pathway? Does the person perceive it as pleasurable? And if the person does perceive it as pleasurable, there is a strong biological basis for that. And we in the medical profession are very interested in mechanism of action. Does mechanism of action actually help us in practice? That's a different matter, because we prescribe a lot of medications every day, but we're not constantly thinking about mechanism of action. Similarly, when we are doing music therapy every day, maybe we don't have to think about mechanism of action all the time, but it does help, because, especially in terms of research, knowing how it works, and why it works for someone but doesn't work for someone else. So that is my understanding of the biopsychosocial model from the music therapy perspective. Thank you.
Yes, sir. This highlights the importance of like client preferred music, which was talked a lot by Dr. Annie in the morning. So can I ask our director, who has been born in a family who has music in his blood, as how you feel music therapy would fit into the model, or how music could be therapeutic in your perspective, sir?
I think a very important question we need to ask ourselves: are we just the body? Are you just your body? Can I have some answers? Okay. Are you just your emotions? Are you just your mind? So then who are you? You are all of it put together as one. So in order for us to understand the human being, we break the human being down into systems. So we say, yes, you have a digestive system in your body. As Sir emphasizes, you have a brain that takes care of your nervous system. You have an excretory system. You have an endocrine system. You have a respiratory system. But just your digestive system is not you. Just your excretory system, hopefully, is not you. Just your brain is not you. You are the sum of all the parts plus something. That plus something is where spirituality comes in. What is it that makes us who we are and what we feel we are? And this is why we need to remember we are not a body having a spiritual experience, but we are the spirit having an embodied experience. And this is where Indian culture gives us an understanding of the term Atma. And in yoga, it is said, Atma Kyati. You want to know who you are, man or rather human, to be gender neutral. Human, please try to know thyself. Because when you know yourself, there is oneness. In that oneness, the bio, psycho, socio, spiritual dimension all comes together and you feel like yourself. When you feel you are healthy. When you feel you are not you are unhealthy. That is where music comes in. Because what does music enable you to feel? It enables you to feel yourself. When I sing, I connect to myself. When I play, I connect to myself. When I listen intently, I connect to myself. That connection to the self is what music brings to bio, psycho, socio, spiritual dimension.
So, does it answer the question, who am I, of Ramana Maharishi?
Absolutely.
Yes.
Nanyar.
Nanyar, or who am I?
You know,
Yes, sir.
nowadays, poor Ramana, in his time, he said, Nanyar. He said, you should ask that question, Koham, who am I? Nowadays, everybody is asking, Niyar. And nobody wants to know Nanyar. Nobody wants to know themselves. They want to know about everybody else.
True, sir. That's really a wonderful beginning, of course. So I would like to further explore into the topic with our panelists. So Dr. Prahan, can you tell me what would be the strategy, since you said music therapy has a lot of social aspects? What strategies would the other aspiring music therapists to take it as a social, what to say, to the social context?
I would like to stress more on the context of our setting, like Indian context. What I feel is somewhere music therapy is in early budding stage in India, and by default, social component is still it has time to kind of be understood and implemented. So to promote the social component, what I would what I feel, we have to create more awareness among the community, because music therapy is something which is not yet uh, l- seen as a therapeutic model by the general community. People do enjoy music. As I said, music is something universal. People do enjoy, people do follow, do practice, but they don't look it as a therapeutic model. So one thing is, maybe we have to take it up in a manner where we can create community-based programs, community-based sessions of music therapy, targeting specific audiences. Because we have in communities, there are like antenatal mothers, geriatric population, under 5 children. Everyone have their own unique challenges, unique needs. Those needs can be addressed by music therapy, and maybe customized community-based programs has to be planned. Second aspect, somewhere government of health, like the government health department, uh, they are doing lot of programs, lot of efforts for the health of the community. However, music therapy is not yet there in their picture. So one possibility is where we can collaborate, because most of the masses go to the government health centers, and there we can actually have a detailed sessions where we can create awareness, because when we go house to house, that awareness will reach, but when you go to the need, when the need is felt, people are more receptive. So when we go to the health centers and we create sessions or kind of have programs to create more awareness, maybe health education session on music therapy, that can provide more acceptance in the community level. And third, last, I would say like another aspect is we have to have it as a holistic, not just therapeutic, but also the non-therapeutic aspect of music therapy. So we have to create platform where people look at music as a way of expression, where they feel that yes, if I would like to express, I would like to express through music. So the concept of music making should be promoted, where it need not be a person need not be an expert to play an instrument, where they can express themselves. So I would say like a long-term vision we can have at a community level. We have recreation centers. So every community, rather every village should have a place with certain instruments where when people want to express themselves, they go there and they do music making as they feel like. Because this is something which everyone can do. Only thing is we have to promote in a manner, because now the understanding is music is something a musician or an expert only can play. But music making is something which anybody can do, and that can promote that social aspect as well.
Sir, well said, sir. I think we are in the beginning and we do a lot. We go to the geriatric community, to the transgender, and especially in the geriatric community, they very much want to join us and to sing the elders. So what you say is, yes.
Also at the rural health center.
Yes, we have started. And also schools, so many schools are there. In school-based program also we can actually develop.
Yes.
Addressing school students, because in school, many students are vulnerable and they can really benefit from this aspect. School is one area where we can.
Yes, sir. Very well taken. So, can I ask you, Dr. Sivaprakash, what do you think about research in this biopsychosocio-spiritual model, and how can we take up that for the growing and aspiring music therapist?
Yeah, that's a very interesting question, madam. Now, see, any model, when we think of it in terms of health and humankind, we always want to do some research on it to prove to the world that this is indeed a viable model. It is a believable model and not just fiction and not just someone's literary work. So, but why research? Now, for example, someone has a music therapy office somewhere in town, maybe not in a hospital, not in a university. Nobody is really going to ask them much. But especially when you're working in a hospital setup, now the medical people want to know, does it work? And even more important, does it cause harm? Because we are so used to the medical model, before a drug comes into the market, is it first safe? Apart from does it work or not? Of course, we all intuitively know that music is not going to cause us harm, but still we might have to prove it that it doesn't cause harm and that it works. And that is one thing. And also, the other reason administrators want to know, is it worth funding it? Because there's now our School of Music Therapy also will have demands. Okay, we want a hall, we want this, we want that. And we want to start courses. We want to invite students. So administrators will want to know, are we doing something, with a sound scientific background before we offer courses, before we expand? So we need to convince our administrators. So these are maybe the reasons why research is needed, though you and me might intuitively know. I often wonder, is research needed at all? Because there is music therapy in my life from morning to night. Apart from the time I'm working in the hospital, there is always music in my life. So I don't need to be convinced that music works because I'm constantly using it on myself. But, but unfortunately, people need to be convinced through a particular method. That is research. But then what are the challenges? It's not easy at all. It's far more complicated than bringing drugs into the market or research on surgical procedures. Why? That's because, see, let's just rewind a little bit. When I'll use the paradigm of drug research. Now, still not very long time ago, we all thought drugs had the same effect on all of us. Now, if I give paracetamol to somebody, we expect that the pain is going to come down, the fever is going to come down a lot. So that was some time ago. But then people realized that even drugs don't have exactly the same effect on people. Okay. And some antibiotic doesn't work for someone. Some painkiller doesn't work on someone. So then came in personalized medicine, pharmacogenomics and all that. But despite that, it is definitely more predictable than music and yoga and all. Definitely, because we are using medications all the time in our practice. So more or less, I know that I can expect this kind of an effect. Now that is not possible when it comes to music. So now, when you do research, you need to define something as an intervention. Let's say you're doing an RCT. What is an intervention? An intervention is a surgical procedure or a medication, which should be the same for everyone. If there are 100 people in my research, all of them should get the same intervention. Now, to define music as an intervention, it's not going to have the same effect on everyone. So then how do I define it as a standard uniform intervention? So there comes the first challenge. And it varies a lot from country to country based on socioeconomic and cultural factors, based on somebody's educational and economic background. It's going to vary a lot. So then that is probably the single most important challenge when it comes to research in music therapy, and I don't have a very easy solution for that. How do we circumvent that? But then again, coming back to the thing that we were discussing earlier, if it induces pleasure in that person and that triggers that person's reward pathway, then that is an effective intervention for that person. So the last part which I would like to say is, maybe the traditional research model that we use for medications and surgical procedures might not work for complementary therapies like yoga and music. Maybe randomized controlled trials might not work. So then we have qualitative research. Okay. But many of us are not really experts in qualitative research. We need to work a lot on that. And there are many people who say that for such therapies, qualitative research plays a very, very important role. So though you might have just 20 people or 30 people in your sample size, but what you learn from that might actually contribute a lot. Of course, it's not generalizable, maybe, because you obviously can't extend it to the entire population. That might be relevant only to those 20 people or 30 people who participated in your study. So that is yet another challenge. So we all need to, I think, collectively work on how to overcome these challenges, learn from countries that are ahead of us in this regard, and how do we implement it in our own setup with our own people and patients. But yet it is needed. There's no denying that research has to be done.
Thank you. I remember seeing in the morning Dr. Annie's presentation, the qualitative research and the thematic analysis you have brought in, and I think that would be a good forerunner for us to follow. So I would like to ask Dr. Baishali, how do you feel, what differences you feel working on the psychological side in the expression or application of music therapy?
Of course, psychology, working on psychology side means that in the music therapy process, it is very much integrated to the clinical aspect of the person. So it is not separated. I mean, in music therapy, it is not that I'm going to separate the behavior and look into it, or I'm just looking at the emotion and ignoring the biological aspects. So what I feel the mechanism is more of a cyclical mechanism. So, variation in one component, be it psychological component or a biological component or even a social component. Let me give an example. For example, if someone is suffering with depression, so due to the depression or part of the depressive symptom, the person will have a tendency to isolate him or herself. So this isolation, as it is has an effect on the social life of the person in terms of interpersonal connectedness and all. So similarly, this isolation also causes, has some detrimental effects on the physical health, right? So being a psychologist and of course as a music therapist, when I will look at the mental health of the individual, at the same time I also have to incorporate the biological or the physical aspect. So definitely I will help the person to be involved in just not music, just not listening, but I will try to include more of active components in it. So where the person will have the opportunity to connect, maybe in a group environment, to play, to have a drum circle, to share and exchange with others. So where the person will have to make a deliberate or, intentional connection with other people. So that's how the psychological aspect is definitely a very important and one of the inseparable, unit in the whole process, to look at the clinical symptom, to look at the clinical context, and of course, most importantly, what Dr. Ananda sir said, that the person himself as a whole, what to say, the oneness in the person, what we should give the most respect to. Yeah.
Yeah, everything trickles down to oneness. So finally, Dr. Ananda sir, how do you say we could feel or experience spirituality by music?
I think anyone who sings, when you sing, you lose yourself. When you make music, you are not there anymore. It is just the music that is there. Psychologists have given a term for it called the flow experience. The music, you were making the music. So initially there's a lot of doing. I am hitting the note. Sa, I am doing the thala, tha, ka, di, mi. You have that. But then after some time, as you're going into it, there's less and less of you and more of the music itself. Now, this is where you lose the little I. The little I that says, I am Dr. Ananda, I am a professor, I am the director, all of that I, which is a created mal identification of who we are, called asmita or ahankara in yoga. We lose that and we start to realize I am not just what I thought I was, I am the universe. It is often said, it's the universe in the drop. It is the whole universe in you. So how do you experience it? Well, let us just try for a few moments. Can this group here, okay, we divide, this is one, and this is a little smaller team, but very strong team. Okay, so this team, let us all just try. Are you willing to try something? Sa. Good. Now this team. Sa. Now this team. Sa. I told you they're strong. Sa. Now these two. Sa. 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 Now only this team. Sa. Now these two. Sa. Now all three. Sa. Now all three. Now only the middle group. Now only this group. All three. Sa 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 re 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 sa 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 ne 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 sa 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 re 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 sa sa sa. Only this group now. Sa 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 ne 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 re 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 sa 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 re 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 ne 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 sa. Now all together. Sa 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 re 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 ne 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 sa 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 ne 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 re 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 ne 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 sa 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 sa. Sa, 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 sa. You have just experienced it. I don't have to put it in words.
I don't think any time before this room would have been so serene, so harmonious, because we had come here every week for so many other functions. I think Dr. Prahankumar, Dr. Sivaprakash should accept if I say that. Yeah. So that has been a really wonderful experience. So having come to the end of the productive discussion, from the panelist, can I ask a single line or a phrase? How would you like to express about music therapy, or how music therapy can be called as a biopsychosocio spiritual model? Your expression or your take-home message to all of us. So can I ask from Dr. Sivaprakash, sir?
Should it be only one line, madam?
Anything, sir. No. It could be one word or a line
Okay.
or a phrase or whatever you feel like.
Okay, to make it as succinct as possible, we see when it comes to medicine in general, when we do research, we are not passionate about what we are trying to prove or disprove. Okay, I don't start with a bias, but what happens is we happen to be a passionate lot. We believe so deeply in music therapy or yoga therapy. So when we do research, we want to prove that it works. Okay, I'm not attached to a drug like olanzapine. I'm not attached to a drug. So I don't care whether it comes out as effective or ineffective. So we are starting off with a bias. Now, another very interesting thing is there's something called participant bias also. Now, when you invite people to participate in a drug trial, okay, they're going to probably come for the money. Okay, but when you invite people to participate in research on music or yoga, it's possible that those who give consent are intrinsically positively disposed towards music and yoga. They probably want to participate in the research because they like music, they like yoga. So your results are probably going to be skewed anyway. So that's just a continuation of what I was saying a few minutes earlier. Yet another challenge. Okay. But the bottom line is that see, I must emphasize here, those of you who haven't read the book by Daniel Levitin, he's a neuroscientist and a musician. And he's written a book. He's written a couple of books. One of them is called This Is Your Brain on Music. Then he's also written another book called, I think, The World in 6 Songs or something like that, or 8 songs. I'm not sure. So all of us must read that book. I've read that multiple times. So he talks about how it is such an intrinsic part of life that it doesn't actually need any advocacy or any further support or research. It's so natural and intrinsic. But people are probably not aware of that. And as one of the panelists said, we still don't remember it enough in the medical context because we think only about medicines and surgery and all. So I think as people who are passionate about this therapy ourselves, I think the take-home message should be that somehow can we spread this passion? It should not be just among us. Can we somehow pass it on to people who are sick, people who are maybe healthy, people who come to the hospital for some reason, pass on this passion and we tell them, see, you're probably music is already a part of your life. But did you know that you could use it to enhance your health even further? Did you know that it can have a tremendous effect on your health? So pass on this knowledge and let's not just be tied down by research and proving to the community and proving to people through research that it works, because intuitively we all know it works. So I think we somehow need to spread that message. And I believe we should start very, very early. Dr. Prahankumar was talking about the social setting. And I believe that it is especially important to start with children. Maybe even start with pregnant women. Okay, start very, very early because it's in the first 5 to 10 years of life that maximum brain growth is happening. So you teach children how they can use music to enhance their health and their life. So they've learned a skill for their entire life. So it's easier to target them than target adults, when they are much older. But how much is it possible? Can we really reach across to all the schools in our country, target all the children? I believe if there are, activists and people who are into advocacy, we can do it. So I think it should go beyond the hall, beyond the university. And that is, I think, very, very important.
Yes.
Thank you.
So can I ask you, Dr. Prahankumar, your message to the audience?
No message, ma'am. But the concluding thing in one sentence, what I would say, music is what I feel is it is a divine experience which brings about change at a vibratory level of individual, thus impacting the physical, mental aspect. And once we change at the vibratory level, we are in resonance with other, I would say, other human beings, thus addressing the social aspect. And eventually, as Ananda sir said, eventually we are in that one common state, connecting with the entire universe, connecting with everyone, ideally reaching out to the spiritual aspect as well.
Sir. Dr. Baishali?
Yeah, again, it is not a message, but it is my understanding of music therapy. That music therapy is something that it basically provides a space for intersubjective connectedness. And in the process of that subjective exchanges through the aesthetic medium of music, it is divine, it is aesthetic. So with such a medium that we can perfectly tune with each other's emotions, perception, feelings, behavior, and that is something finally lead to an engagement in the therapy where again that it is just not body, just not mind. So it is basically the meeting of mind, body and spirit of two individuals, therapist and client, or in a group setting more number of individuals. So I think that well explains how the different perspectives actually come into this process and they blend very well with each other. Thank you.
Oh, thank you. We'll get the final word from Ananda sir.
We have a Vedic chant, Asatoma Sadgamaya, Tamasoma Jyotirgamaya, Mrityorma Amritangamaya. That is basically the journey of music therapy, a movement, a journey from illness to wellness, from I to we, from disease to ease, from divisiveness to oneness, and from the individuality to the universality. Thank you.
Sir. So there is nothing more to tell about that. And we heartfully thank all the panelists for their time and for sharing soulfully. So it is all words from inside, like not scientific things, what we all have experienced day in and day out. So it has been a wonderful day. So we have come to the fag end of the day. Yes. So just 5 minutes, our registrar, Professor A.R. Srinivasan, who was a panel member, was not present here because of official commitment. He has a 5 minutes recording of his thoughts. We'll go. So we all will move down so that we'll watch the his words, and with that we will close the session.
Greetings to this eminent gathering. Well, I would just like to briefly introduce my humble self. I am Professor A.R. Srinivasan, also known as Velluri A.R. Srinivasan. And I've been working here at Mahatma Gandhi Medical College Research Institute, a constant unit of Balayogi Vidyapith almost since 22 years, ever since its inception. And I'm also proud to state that I am presently serving as a registrar of Balayogi Vidyapith. And most importantly, and much more closer to the heart, I am an adjunct faculty in the School of Music Therapy, which is an important component of the Institute of Salutogenesis and Complementary Medicine. Having said that, I'm very happy actually that I am a small component of this mega affair, this important panel discussion, music for the healthfulness, a very impressive topic. Of course, at the outset, I must confess that I'm not in a position actually to come and partake of all the niceties there in person due to an unprecedented one. And from my perspective, I will just say this is an excellent initiative because the concept as such, the biopsychosocial and much later the biopsychosocial spiritual components, if they are embraced into the realms of music and music therapy, I think that is perfect. Because always there are the two schools of thought, the reductionist approach as well as the approach from the holistic perspective, isn't it? Trying to even address music or music medicine or even music therapy as such. Just fragment it and take it as a piecemeal or probably consider that actually as a whole. So on that note, I think I'd just say way back in 1977 when the biopsychosocial model was elaborated by Engel, much later only the spiritual component came, and I think it came in much at a very prestigious and a prominent place, especially when the World Health Organization also introduced the concept of spirituality into the well-being, holistic well-being. Earlier, it was only physical, mental, and social well-being. So it augurs really well in the context of evidence-based practice in medicine. Now, having said that, I would like to draw your kind attention actually from the perspective of music, musicology, music medicine, and music therapy. After all, the model is going to talk about the holistic approach. And ever since time immemorial, we have been having a lot of anecdotes and also very impressive contributions down the line of illnesses, especially of psychosomatic nature, because after all, there is a mental trigger or a stimulus, which in turn is capable of actually being superimposed or exacerbated by the genetic predisposition that a person has, he or she has. I think this is very, very important. That is the reason why probably music medicine or music therapy works well in such a scenario where both the biological component as well as the psychological component are there. My dear friend Professor Sivaprakash, in fact, we have realized it for sure. Way back, I think probably some 20 years before, I don't exactly remember the date on which when the School of Music Therapy had a humble beginning as Music Medicine Unit. Professor Sivaprakash, the current head of the Department of Psychiatry here at Mahatma Gandhi Medical College and also an adjunct faculty, and my humble self, we started the very naive, innovative, what should I say, actually, very novice start of music medicine with the available armamentarium here. And one of the very first patients actually was from dermatology, a patient, Pemphigus vulgaris. And we were able to really convincingly prove that by the administration actually of a holistic mixture of both classical, semi-classical and folk music, actually the patient-specified music, we were able to ameliorate the symptoms, especially of the morbidity associated actually with anxiety and stress. This was one of the earliest evidence that we have seen, we have perceived for us, not through literature. And subsequently, a lot of other research has been going on, both with reference to communicable diseases as well as non-communicable diseases. And the spiritual component is something which is associated actually almost in parallel with the mindfulness, isn't it? What is mindfulness all about? Mindfulness all about actually the ability to live for the present. You appreciate, you meditate. Probably, I think it is much more exalted state than meditation. It's a meaningful meditation wherein you don't bother actually about the judgment process, but you just bother actually about the present and try to be in a state of equipoise. So I think music medicine has come to state here now. The biopsycho, the spiritual component or the biopsychosocial spiritual component has come in. And as a biochemist, I have some selfish reason to also talk about the role of the neurotransmitters here, the neurochemistry that is very, very important here, especially the role played by dopamine, melatonin, serotonin, and also the stress hormones, cortisol, as well as epinephrine. So all these things probably, I think, have paved the way for a lot of very interesting features that are going to be unraveled by evidence-based research. Finally, we'll be able to probably strike a harmonious chord between mindfulness and spirituality in the context of biopsychosocial spiritual thing. So this is very, very important, not only from the perspectives of the individual music medicine or music therapy, but also as the community therapy. Community music therapy, just like community yoga therapy, it has come of age. And a lot of very interesting things are happening. So on this note, I'll just try to sign off, and then I equally look forward actually to hearing the recordings of this very impressive panel discussion, probably at leisure, and then I'll get back to you. So enjoy your stay here. And once again, best wishes actually to the learner resource persons and all the avid delegates. And a special thanks actually to Dr. Sobana Madam, who's the academic head of the School of Music Therapy, which is coming under the wings of the Institute of Salutogenesis and Complementary Medicine, headed so ably by my dear friend and well-wisher, Professor Ananda Balayogi Bhavanani. Thank you.
Thank you very much, sir. We will not take much of time, just 5 minutes. We will honor the panelists and we'll go to the valedictory. So it has been very nice to have the panelists here. So we would like to honor them with a memento. So, yes. So we would request Dr. Annie to honor the panelists. So it's a pride moment to honor Professor Sivaprakash sir with a memento and a certificate. Vandar. Sir, someone has to read. Abuna, can you read out the names, please? Yes, sir.
Dr. Prahankumar, sir. Dr. Baishali Mukherjee, ma'am. Dr. Ananda Balayogi Bhavanani, sir. Thank you so much. And lastly, Dr. Sobana, ma'am.